Alright, so I'm looking at this video of the kid doing push-ups. Like you said, Tucker, range of motion is an issue, so I would make sure that their chest touches the floor. But besides that, they need to pick their head up, so I'd tell them, no sagging head, pick your head up a little bit. There's also that sag in their lower back. I would tell them to tighten their stomach muscles, tighten up your abs, keep your back straight. If the verbal cues don't work, and then I would use a visual cue. So I could either take a picture or video and show him what I mean by these things that I'm saying if it's not working. I could also demo myself, show him incorrect form, and then show him what good form looks like. And if that's still not working, we move on to the kinesthetic cues, where I'll ask him if it's okay to touch him, and then maybe I would press on his stomach a bit, suck in your stomach, tighten up that low back. Maybe I would physically move his head up a little bit, show him where I want his head position to be. Maybe I could pull his shoulders forward a tad, just maybe straighten him out a bit, which would prevent some of the lower back issues. But if none of that seems to work and he still looks the same, then you think about underlying issues. If he can't go all the way down, that's a pec and deltoid strength issue, and you can just switch to modified until he builds up the strength to do that correctly. A lot of the sagging lower back stuff, besides just knowing how to activate your core, a lot of it has to do with weak lower abdominal muscles, maybe sometimes tight hip flexors, tight psoas, but primarily I'd say, in his case, especially with kids who are lanky, it's going to be weak ab muscles. So I would have him work on maybe holding perfect plank positions, maybe work on leg raises or knee raises to strengthen his abdominals. So that should collectively help him eventually.